back pain. I know you guys are looking at my hair going, it's all gone. I shaved it off. I don't like it. It's more fun for the summer. All right, we're gonna be talking about one-sided low back pain. So the difference is most people get this really funky kind of a middle of the low back, right where the L5 joins that sacrum. That's where a lot of pain is, but if you look at how the pelvis is designed, what ends up happening is pelvis looks like this. It's gonna load with shear. It's gonna load on one side more than the other. You're gonna wind up driving more horsepower down one leg versus the other side, and that's when you have problems. So all these people that are going out there, listen, if you're taking a foam roller and you're smashing across here, you need to stop that. So if you're, I don't have a foam roller here, but listen, if you have somebody just smashing the hell out of dead center on that low back with a foam roller, that's great. It's gonna feel better. It's gonna make you feel all awesome. You probably sleep better for that day. The problem is it's gonna keep coming back. So if you're grinding away with a foam roller on your low back, stop. There's better things to do, and we're gonna even out that pelvis. The big thing we wanna do is we wanna take the pelvis, remember, it's like a bucket, holds water. We wanna make sure it doesn't wanna spill out any water anytime we're moving. 20 muscles on either side, there's a lot going on. So I'm gonna show you how to release that QL primarily, which is that quadratus lumborum, right here, sits between that 12th rib and the top of that iliac crest. That's what clamps down, that's what hurts, that's what causes you problems about 99% of the time. And most people aren't releasing it right. So we're gonna grind out the muscle, we're gonna stretch out the muscle, and then we're gonna retrain the entire pelvis all in 3 moves. So super easy. First thing you wanna do is you wanna grab a soft ball, not a soft textured ball, actually a softball for baseball. What we do is we grab a softball. The softball is gonna go right here. So we're gonna load that above the hip and below that 12th rib, stay off the rib. And this is gonna be super unpleasant. So you can see the softball there. Oh, we're gonna lay across it like this. The reason I'm using a softball is because I'm a little thicker than most people. Then we're gonna take this leg, hands this way, and we're gonna draw it up. So you can see I have the softball here, so I'll do this so you can see. We're just gonna draw the leg up and then bring it back down. We're not gonna extend it, we're just gonna bring it to that 90 degree angle or that 45 degree angle. So softball's tucked in on that QL. We're gonna bring the leg all the way up to the shoulder and then all the way back down. The reason we're doing it actively is because we're gonna turn on the hip flexors, which is gonna turn off everything else in the back. So we're gonna grind away, 2 minutes of work. That's number one. Now that we've turned off the muscle, now we can stretch everything out. There's a really slick stretch you can do. It's really straightforward. You can pretty much do it anywhere. So I'm gonna make sure I get all this on video. What we do, I'm gonna get one of those camera stands, is you can use a door jamb, rig, anything. You're gonna take your hand, reach it up over top. So I am in line with my head. You're gonna take your foot, kick it out on the opposite side, and then you want to be really important that it's really imperative that you're driving out with your hip. So you can push against this however you want, but all I'm gonna do is I'm gonna really push out just with the hip. The arm is gonna stay anchored to the rig, and I'm just gonna hang out, really push, 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 push. Big deep breaths. Remember that QL attaches on that 12th rib, so people miss that. They hold their breath for an entire stretch, all bad. Hang out, 2 minutes, call it a day. That's number 2. Number 3, really easy way to balance out your pelvis without doing a bunch of different movements is what's called a lunge step band rotation. Problem is most people don't do it right. So the band sits at about hip height. We're gonna grab on, real easy. It's already loaded. I'm gonna step forward with the outside leg compared to the band. I'm gonna step forward, and then I'm gonna twist, and then I'm gonna come back to neutral, push back up. So all the way down, rotation, all the way back up. 3 sets of 10, I promise you this, it'll light you up like crazy, and that's how you get rid of that super bad one-sided back pain. Just clear it out like that. I'm Trev, SmashweRx, hanging out at CSA on a Wednesday, always having an awesome time if you're not training here.